Good morning, Mr. Brown. It's Dr. Brown. How you doing? All right, all right. How you feeling today? I'm doing okay. I'm doing okay. Cannot complain at all. Okay, okay, okay. You got a cold or something, or you just okay? Huh. All right. Let's hope that goes away pretty soon here. Yeah, yeah, that okay. Okay. Right, right. A little too warm for that. Man, I tell you. Okay, all right, sounds good. Okay. Good morning. Good morning. Good morning. And of course, good morning to Mr. Brown. I hope you continue to be feeling well. It's always good to be back here on the station to chat with you. And like I said, always good to be above ground, of course. And good, exactly. Good morning, listeners. You're locked into WVOE, the voice of Ebony, where your health is our heartbeat. I'm your host, Dr. Christopher Brown, CEO and founder of Pressure MD and that pressuremd.com, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. So this week we're going to talk about sickle cell anemia. We talked a little bit about stress last week. This week we're gonna pick sickle cell anemia. Many of you may have heard about sickle cell anemia, and some people may even know somebody with sickle cell anemia. And what sickle cell anemia is, it is an inherited blood disorder. And inherited means it travels through the genes, so you get it from one of your parents. Um, and blood disorders just mean that it does affect the blood cells. And the blood cells that it affects are what we call the red blood cells. Those are the ones that carry oxygen around to all parts of the body. So in order for your body to work, it's got to have oxygen, and these cells help carry that oxygen to the different parts of the body. So, so what exactly is sickle cell anemia? So this is a genetic disease that affects those red blood cells, um, and what it does is that it changes them. And this gene, and you have to have two of the genes in order to have the disease. Um, and what it does is it makes these cells stiff. So normally your red blood cells are round, they're really flexible, so they can kind of move easily through the blood vessels, especially when those blood vessels get really small. And what happens is that if you get this disease, this genetic disease, where where you have two genes that are abnormal, these these red blood cells can become really sticky, and they're shaped kind of like a big comma, what something they call a sickle that they used to use as farming equipment, and that's where it got the name sickle cell. And these when it happens, like I said, they change shape, they become really stiff, and whenever they get, especially into those smaller vessels, they get stuck. And whenever that happens, it basically blocks blood flow into those particular, whatever organs they're getting stuck in. And so that's what sickle cell is. Now, why is this important to people, and especially African Americans? So the sickle cell was came about as a protection for malaria. So back in Africa, there's a disease called malaria that can make you really sick. And what happens is that, the this malaria entity goes to the blood, but it has a harder time with those cells that are sickled. And so over time, like I said, our bodies developed a way to protect ourselves from this disease. Now, of course, when you come to America, we don't have malaria, but we still have the sickle cell disease. So this becomes a little harmful to us here. And so about 1 in 365 African American babies are born with what they call sickle cell disease, and this is where you get two of the abnormal genes from two of the abnormal genes, and one from each parent. Now, if you just get one of the abnormal genes, what happens is that you have a tendency not to have the complications, but you do have some protection from the malaria disease. And about 1 in 13 African American babies are born with what we call this sickle cell trait. Now, so those are kind of the numbers. Now, of course, you might be wondering, okay, so the blood gets stuck, how bad is that? Well, what happens is that, when these cells get stuck, they can cause a lot of pain because remember that those organs are not able to get the blood flow that they need. And so you get very severe pain. You can get damage to the organ because remember that organ can no longer get the blood flow. And then you can get infections because, yet again, you need that blood flowing in order to kind of clear infections. And then you can even get things like a stroke because the same way, you can get a blood clot in the brain. Well, if these cells aren't going through, you get the same thing. And so you get what is called a stroke. So that's the reason why it's important is that, this is a serious condition that can happen. It is inherited. So you don't have you really don't have any way of changing, whether or not you get the disease. And it's different. So some people might have, sickle cell disease and they, what we call crises might not be that bad. And some people have some very, very, very severe episodes of severe pain that requires hospitalization in order to get that pain under control. Okay. So we know what sickle cell disease is, we know why it's important and what it can cause. And just to go into a little bit more about the what it can cause, you might be looking for, say, hey, how do I know? So in terms of the symptoms, some of the symptoms can appear as early as around 6 months of age. And kind of like we said, that can vary from person to person, and it can even change over time. But the things that you would find are things like anemia. That's what they call it, sickle cell anemia, because your blood counts will be a little on the lower side. So even if they just do routine checks, even without a lot of symptoms, your blood counts are going to be what we call anemia. Your hemoglobin is going to be low. I think the classic thing that we think about with sickle cell disease are the pain episodes. And like I said, they call these pain crises. And these, like I said, can be extraordinarily severe. And so then require hospitalization where they have to get fluids, they got to get IV pain medication in order to get that stuff, in order to get that under control. Okay. And these pain episodes can vary. Some, may last a few hours. And sometimes people can just kind of push through. Some can be a few days. So you might be in pain for a few days in severe pain. And then some may have 1 or 2 pain crises a year. Other people may have as many as 12, 13, 14 of these episodes. So that's probably the classic thing you think about. And then other things you can have, unexplained swelling in the hands and feet. Like I said, frequent infections, because it does affect the spleen, which is a area where your body kind of fights infections. If it's a young person, they can have delayed growth or delayed puberty. Also, you can have vision problems. So, like I said, yet again, blood vessels, these cells sickle, get stuck, and so you can have issues with your vision as well. Okay, so you might be asking, so how do I know if I have sickle cell disease, or how can I find out? Typically, in America, most newborns are actually screened for sickle cell disease, which is a good thing because you want to find out whether or not you have this, what we call the trait or the actual disease early on, so you could be looking out for symptoms and kind of treat things earlier rather than later. So yeah, most babies are treated then, but there are also tests. You can also go to your primary care. So say that maybe you're adopted, or maybe your parents didn't keep records, and you're starting to have some issues. They can also check the genes inside of your cells to see whether or not you have that sickle cell. So you can also do it as an adult, so you don't have to always do it as a kid. So that's how you find out whether or not you have it. And in terms of treatment, the way that you treat this is that typically, a lot of times, you want to make sure you stay hydrated very well. One of the things one of the medications that we use is something called hydroxyurea. It's a big name, hydroxyurea. And what hydroxyurea is a medication that kind of helps to prevent the episodes of sickle cell. And it reduces the frequency of pain episodes, and then it reduces the need for blood transfusions. So that's one thing that you can do. And then there are a lot of exciting treatments that are going there. There's gene therapy. And like I said, they're working on that to cause that. To They're working on that in order to find ways to treat that. And then the other thing, kind of like we said before, the big thing are these pain crises. So when you go in with these pain crises, they give you hydration, they give you pain control. They look to see if there are other things that are going on with you. They look for signs of stroke. There's a significant thing called acute chest syndrome, which is really life-threatening, that they evaluate for. Other things that can happen are that, you can get something called avascular necrosis. And this is when the bones don't get a good blood supply, and the bone actually dies. And this often happens in the hip. And this can be a very painful and actually debilitating condition. Also, there's something called pulmonary hypertension, which happens because, like I said, the blood can't flow across the lungs, and this can cause what we call hypertension inside the lungs. Splenic sequestration. This is where all that blood gets stuck into what we call the spleen. So that's an issue as well, along with a lot of other things. So that's kind of the breakdown. So sickle cell disease is a genetic trait found, like I said, found in African Americans and people that are descended from from Africa. And like I said, there's some other Mediterranean regions and stuff of that nature where they also come from. And what it does is it's a genetic disease that causes changes in your red blood cells. You get the gene from your parents, so you can get one from your mom, one from your dad. If you get the bad gene from both of your parents, is what we call sickle cell disease. If you just get one copy of this quote unquote bad gene, then it's what we call a sickle cell trait. Most of the time, if you have sickle cell trait, you don't get the sickle cell crises. But if you have the sickle cell disease, you're much more likely to have these pain crises and complications from sickle cell. You get screened as a child. Most of the time they do it as a baby. And like I said, if you don't get it as a child, or if you can't find those records and you have questions about whether or not you have it, you can also have your primary care clinician run tests for sickle cell itself. In addition to being diagnosed, you want to make sure that you keep an eye on your symptoms. Make sure you follow carefully by your doctor. If you have pain, or if you have things that are going on, like I said, maybe you got vision changes or anything of that nature, that needs to be evaluated earlier rather than later. And you also, kind of like I said, if you're having pain, you want to be treated earlier rather than later. So like the longer you wait, the more severe these pain crises can get. We do have medications for this. One of the most popular ones is what we call hydroxyurea. So if you do have sickle cell disease and you've been getting these episodes, ask it, and no one's treated you for it, make sure you ask about this medication, hydroxyurea, and see if that's something that can be helpful for you. There are some tests that are in the future that are planned, but like I said, right now, a lot of these are still experimental. They're trying to see if this stuff is going to work for us. So that's pretty much it for today. I just thought that it might be a good idea for us to have a talk about sickle cell, just to raise awareness about the disease, so you can know awareness about it, so you can know what it is. If you know family members, or friends or anything in nature that may have that, or if you know people that are having kids, that are having children, make sure that they're getting their kids screened for sickle cell whenever the kid comes home, and kind of go from there. So that's it for the day. If any questions, let me know. Mr. Brown, you got any questions about that? Okay. So like I said, the biggest one is going to be pain. So like I said, a lot of times they'll just have pain in different areas, especially in that bone area. So that's one of the big things that sickle cell patients will have. Is that pain. Now you may also have some other things, like I said, if you have swelling in the hands and feet, especially people, of course, a lot of people have swelling in the feet, especially sometimes, but if you have swelling in your hands and your feet, that needs to be evaluated. So, because sickle cell could be one of the causes.
Okay.
Because there's not a lot of, it's not common for people's hands to swell. The feet swelling, some people like when they're up on their feet all day, feet are swell, they go to bed, it goes down. But like when your hands and feet swell, that always needs to be investigated. So you got that.
Okay.
If someone's getting like frequent lots of pneumonia, your kid is sick more than usual. Like I said, that is something that needs to be evaluated, and that kid should be screened for sickle cell if they haven't already. And then, like I said, if someone has a young person that doesn't seem to be growing well, that's another reason for getting screened for that, because people with sickle cell have a tendency not to their growth is delayed, or puberty is delayed. And then the other thing is, like I said, vision problems. So if you got vision issues that kind of pop up all of a sudden, especially in a young person, that definitely should be investigated as well. Okay. You're welcome. You're welcome. All right. All right. Any other questions? All right. Okay. All right. Okay. Well, thank you very much for the opportunity. I look forward to chatting with everyone next week. You have a blessed day. God bless you as well. Take care.